guys. Hello guys. In today's episode of High Yield Series USMLE Step 1, we will be talking about this is the question right here in front of you. A 22-year-old athlete collapses during practice. Cardiac exam reveals a harsh systolic murmur at the left sternal border. And this is important information. Looking at the murmurs, you have to look at the locations as well. So that gives you a very high yield clue that you can eliminate other options. Now, this is at left sternal border, and it is an systolic murmur. You know, there is another systolic murmur that is at the right upper second intercostal space that is aortic stenosis. That is in the second intercostal space right side. Okay, parasternally present. Now this is not uh, given at that location. This is at the left sternal border. So we will read through it. The murmur increases in intensity when the patient stands from a squatting position. This is very high yield. I'm talking about very high yield information here in this question. This is a relatively easy question for you guys. You can figure it out, but the information is very high yield. That is, the patient stands from a squatting position, and there are three to four different scenarios of it. The USMLE question can say that the patient rises from sitting position, supine position, and any position. Basically, what they want to know from you is that standing decreases the preload. Why? Decreases preload. Why? I ask you why. The question answer is that when you stand, gravity pulls the blood in the veins of lower extremity. So what happens? The venous return decreases. So in turn, the preload decreases. So is basically this murmur is basically increasing in intensity by decreasing the preload. This is an exception to the all other murmurs. This is very high yield, guys. You will be tested again and again on USMLE. Decrease preload, increase intensity. There are only two very high yield murmurs for USMLE. Aortic, sorry, mitral valve prolapse and HOCM, hypertrophic obstructive cardiomyopathy. These are very high yield. I'm talking again and again to stamp it to your mind that mitral valve prolapse and HOCM are the most high yield parts. USMLE likes exceptions. So these are exceptions to all other murmurs, which increases in intensity with increased preload. But these two increase in intensity because decreasing preload. This is very high yield, guys. So we will read through the options. Increased venous return to the left ventricle. No, this is not the right answer. We have called it before. This is decreased venous return to the left ventricle. This is the right option, but we will read through it. Increase afterload decreases left ventricle outflow obstruction. This is not right because there is no afterload being increased. Afterload was increased in this position, okay, squatting position increases afterload. But now we have gotten up to a standing position, so this is not the right answer. Decreased contractility of the left ventricle. Okay, this is not alright as well because there's no clue about the contractility of the left ventricle. So this is the right answer, guys. Now we'll talk about very high yield points quickly, guys, about the HOCM. HOCM meaning hypertrophic obstructive cardiomyopathy. This is the diagram you need to know for the conceptualization. This is the IV septum being hypertrophied. This is not concentric hypertrophy. Remember, guys, this is not concentric hypertrophy. This is hereditary. This is the most common cause of sudden cardiac death in athletes. So, okay, so remember that. This is the most common hereditary heart disease. It is a dynamic change in murmur with decrease or increased preload. It dynamically changes versus aortic stenosis. It is a fixed murmur, okay? And there is crescendo decrescendo. You can get off with that kind of information because aortic stenosis is also crescendo decrescendo. But remember, guys, aortic stenosis will present most commonly in bicuspid valve patients in early stages. In older patients, there will be an older patient presentation for aortic stenosis. These are the high yield clues to look forward in the question. Right? Okay, guys, this is a late peaking murmur, meaning that it peaks late. This is an early peaking crescendo decrescendo murmur. Okay, and this is autosomal dominant, guys. HOCM, myosin heavy chain mutation, that is. I've already talked about sudden cardiac death in young patients. So I've already told you that this is very high yield, guys. Remember, there's another murmur which increases in intensity with decreased preload and decrease afterload. Now, this is high yield as well because decreasing high afterload means we are uh, dilating the arteries next to systemic arteries. Now the medications that decreases that will also increase the murmur intensity that are very high yield medications. We have talked about CCBs. Okay, these are the non dihydro pyridine calcium channel blockers, arteriodilate. So this also increases the murmur intensity. So we have got this concept. This is a very high yield concept I'm talking about. Uh, there is mitral valve there. This is a mitral valve. This is left ventricle outflow tract. This is outflow tract, guys, and this is the IV septum being hypertrophied. So what will happen? This this area here, left ventricle, there will be less blood. If there is less blood meaning less preload, or increase afterload meaning that heart pumps great amount of blood in one beat, so there will be less blood left in ventricle. So there will be not much expansion of the ventricle. So IV septum would be obstructing the left ventricular outflow tract. This is an outflow tract, guys. This is normal. This is outflow tract. This is mitral valve. Okay, this here the blood flows through. Now this is narrowed area. So what will happen? You know this concept, guys. When there is a narrow thing to go through, there will be increased velocity across it. And when there is increased velocity, you know from an example of train that there is the train will flow with increased velocity through the track. There will be negative pressure around it. So it is advised to stay away from this, to have a safe distance from the train to be safe. So what will happen? This area, blood will flow very quick. Okay, very quick. So what will happen? This leaflet. This leaflet will be pulled close together to the IV septum. So, okay, there will be increased velocity that creates the negative pressure. This mitral valve will come close to the IV septum. That will be that obstructing cause. So you can understand it. Okay, there's a very high yield differentials, chronic hypertension. This is concentric hypertrophy, guys. This is concentric, okay? Chronic hypertension, aortic stenosis, and then relatively less high yield amyloidosis. But you have to remember it as well. So, two most important, chronic hypertension and aortic stenosis. And remember, guys, heart is a permanent muscle. So it will undergo hypertrophy, but myofibrils will increase in number. That is very high yield. When when a muscle cell like cardiac muscle goes hy hypertrophy, the muscle fiber in the cell will increase. Okay, myofibrils, that is, sorry for the uh, not getting the information very quick, right? But the absolute thing is that myofibrils will increase in number. That is. And remember, guys, it is disorganized. This is very nicely parallel arrangement. This concentric hypertrophy is very uh, kind of parallel arrangement, not disorganized in hokum. Okay? Remember this. Okay, now this is a picture of IV septum being hypertrophic, gross picture. This is IV septum, this is left atrium, the left ventricle. Now look at this. This you can sense it that it is very small amount of space. So it is a diastolic dysfunction of the heart. The heart can't fill properly. When it can't fill properly, it can't pump properly. So cardiac output will decrease. That can you can sense it when cardiac output decreases. It can lead to consciousness loss, loss of consciousness, loss of shortness of breath, kind of things, angina even. Okay, you can remember this thing. Okay, the treatment is simple. Give beta blockers. What will happen? Beta blocker will slow the heart down, slow the heart down, and there will be increased diastolic filling time. When there will be increased diastolic filling time, what will happen, guys? There will be increased diastolic filling of the heart that will fill the heart up and will uh, expand the ventricle, and the obstruction will be temporarily uh, taken away. So this is the thing. You need to know the mechanism of action, guys. Beta blockers slow the heart rate down. CCBs, verapamil, acting at calcium channel blockers at a AV node, basically. You know this. You know this thing from arrhythmia. If you know the pharmacology, verapamil acting at AV node that has most calcium channels. Slow the heart down. Slow the heart down. Again, the same thing. Increase diastolic filling time. Increased diastolic filling, increased left ventricle expansion, and increased preload, increased cardiac output, and this is it. So guys, avoid diuretics because it can decrease the volume, overall volume, and decrease the preload. We can sense it. Digoxin, this is important. When you give digoxin, what will happen? Inotropy will increase of the heart. This is a inotropic drug. Inotropy, cardiac output increases. When cardiac output increases, so what will happen after load? When cardiac output increases, there will be a great amount of blood pumped out of the heart and less amount of blood remaining in the heart. So when there will be less amount of blood in the diastolic phase. So this can predispose, as we know, diastolic phase. So in this phase, when there is less amount of blood, that can lead to decreased preload. Again, the same thing, guys. You have to remember there is decreased preload. You have to remember decrease preload, increase intensity of the murmur. You have to know it, guys. Spironolactone, again, the same thing. Pre-nitrates, decrease preload. Again, same thing. You need to know the mechanisms. And CCBs, okay, blood vessel CCBs. On CCBs on blood vessels that are basically nifedipines, basically, or and other drugs like cardipines, depends, basically depends, we in short terms, ending the drugs that ends in depends. Okay, these can decrease both afterload and preload, again predisposing the patient with a decreased preload can increase the mitral valve being the a left ventricle outflow tract being obstructed between the mitral valve, leaf left, and the interventricular septum. You have to remember it, guys. Nail it down, nail it down. And this is it. This is it, bro. This is all high yield information about hypertrophic obstructive cardiomyopathy. Thank you. Subscribe for more videos like this. I will be making them in clusters, guys.